Hello, everybody. How are you doing? Today we are talking all about your pelvic floor. So get ready. There's some exciting new things to learn here. And we're going to go through a couple slides here. And I'm hoping that this won't take much more than an hour of your time. Feel free to kind of do your mom thing while you're listening to this. And towards the end of the video, we're going to do a couple of exercises, and you will find these exercises during the week in our workouts. So just be aware of that. I am going to pull up my slides for you, so bear with me. Alrighty, so the happy pelvic floor. Got a nice flower here. Now, in today's presentation, you are going to learn a lot of things. You're going to learn whether you have a tight or weak pelvic floor. And as a result of that, that is going to change how you do some of your exercises. So the next point is what to focus on if you have a tight or weak pelvic floor. We're also going to learn the importance of being more aware. So, are you the type of person that do you have problems with leaking, or do you have problems with prolapse? We're also going to learn why a strong pelvic floor goes hand in hand with strong abs. The mom pooch. We're also going to learn how to support the pelvic floor during exercise and daily activities. We are also going to learn how much time this is going to take for you to fix and to improve upon. And we're also going to talk about what this means in real life and how to make sure that you're progressing properly, correctly, and in the right direction with your pelvic floor. And then we're also going to learn how you can take your pelvic floor exercises up a notch. So pelvic floor basics. All right, so a brief little background here. If you don't know much about the pelvic floor is kind of like a sling of muscles, a bit like a muscle hammock that runs between your pubic bone in the front and the tailbone in the back. Now, a woman's pelvic floor muscles support her uterus, bladder, and bowels, and also the uterine tube, the urethra, the vagina, and the anus all pass through all these pelvic floor muscles. So I have a little 3D video here that is going to go briefly through the anatomy of the pelvic floor, just so that you can kind of get a better visual of what exactly is going on here. So, and obviously they're listing off what the pelvic floor kind of controls. And there you can see it contract, and relax, and contract, and relax, contract, and relax. And there's from the inside. There you go. So that's like an inhale. That's an exhale. That's an inhale. That's an exhale. That's an inhale. That's an exhale. That's an inhale. And that's an exhale. So pretty cool little visual there. Hopefully that kind of helps you with what's going on. And there you go. Cool little video. All right, so we're going to talk a little bit more about pelvic floor movement, and you kind of, through that video there, were able to get a little visual of what's going on when you inhale and exhale. So your uterus sits on top of your pelvic floor, and when you look at your pelvic floor contracting, you are looking at resting tones. So basically, Our pelvic floor sits with a little bit of tone naturally just to support posture and our pelvis. Just like, when all your muscles of your skeleton that sort of holds you upright. So at a natural state, there is some tone to these pelvic floor muscles. And so these types of muscles are the purpose of them is to have some sort of tone at all times. And then, of course, we have our phasic type muscles, and those are kind of like the biceps where you can turn them off and on if you need them. So there is a little bit of the difference between uh, certain muscles in the body. So just be kind of aware of that. So as we know that the pelvic floor has a bit of resting tone all the time, and you're probably not able to really tell uh, that there is some tone there. You probably shouldn't be able to feel it at all. Now, when you take a big inhale, your pelvic floor goes down, kind of like if you think of a balloon expanding, and your pelvic floor has to fire to help keep you protected. And it fires more when it's in higher demand. So, looking at this elevator diagram here, if we are I'm going to first speak on a healthy woman. Typically, our pelvic floor at a resting state is at hanging out on this ground level. Um, if you're just doing some, regular shallowish, non-intense breathing, it's very rare that the pelvic floor is going to fluctuate very much from this ground level. Now, what happens when you take a nice, huge, big inhale is your pelvic floor descends down into the basement. And then on the way back, you take a nice exhale, a forced exhale, and that'll bring you all the way from the second, third to fourth, or even fifth floor, depending on what sort of contraction you're fighting for. So if you're doing just slightly exaggerated, you might, get up a floor or two. If you're really forcing it, if you're really pushing it, you're really trying to contract, you're trying to power through something, maybe you can, make it up the fifth floor. Now, when it comes to people that bear down and people that have issues with prolapse, that happens. So let's just say you're not prepared, and instead of contracting like through these upper floors here, let's say something were to happen and your kid was to jump off the top bunk of their bed and you go to grab them, but you're not ready and you're not prepared. And let's say you're kind of in your inhale as you're catching them. Prolapse happens when the pelvic floor goes out the basement window. So there was no contraction here. The muscles of the pelvic floor just the uterus bottom out and go out the basement window. So that is kind of the analogy I want you to think about when you're doing your pelvic floor exercises. Really think of taking a nice big inhale to the basement, and then depending on the intensity of your exhale will depend on if you are at the second, third, or fourth, or even fifth floor. Now, individuals that have issues with, we're going to talk about this a little bit later, tight pelvic floors and weak pelvic floor. Someone with a tight pelvic floor naturally, someone that's just like over clencher in life, and usually if you're a jaw clencher, if you're the type of person that sucks in your belly button sometimes, if you're just a tight, the type of people that are just super clenched all the time, your shoulders are up in your ears, you're tense. Sometimes those individuals that are kind of have tight pelvic floors hang out on these second and third floor just naturally because they're always in a semi state of um, contraction above the normal tone level. So, something to think about. So I want you to kind of think about that a little bit more. And remember that your pelvic floor has to fire quickly in order to protect you and prevent this whole out the basement window prolapse effect. So, again, at this resting tone, you are at this ground level. And remember, at the basement is where your pelvic floor will come out if you're doing a big um, inhale, or if you're the type of person that also bears down when you're exercising. So instead of contracting when you exercise, some people do the opposite and bear down. And I want you to really think about avoiding this because this is what leads to prolapse. Now, we're learning how to handle the pressure that goes up and down this pelvic floor so that we can prevent and stop bearing down on the pelvic floor and, of course, prevent prolapse. When you bear down too hard, it's like trying to push your pelvic floor out that basement and yeah, and this is going to lead to prolapse. And prolapse happens during labor quite often because you have to bear down so hard to push a baby out. So, usually, women with intense, if they have had natural childbirth, this is definitely at a higher risk versus a C section. Now, someone who had a C section is still also at risk because of all this weight and stretching on the pelvic floor at the ground level. So, you C-section ladies, you're not in the clear 100%. You're probably better than someone that had a vaginal delivery, but you're not in the clear 100%. So I don't want you to discount this work if you've had a C-section. I still want you to focus on this too. There's probably for some of you some additional work and focus that can be done here. So when you do a purposeful pelvic contraction, when you voluntarily contract your pelvic floor, so something like a Kegel, or when we do our correction breaths, our connective breaths here, when we try to focus a little bit extra on the exhale. Um, this is, how we can work on gaining some additional strength for these muscles by really trying to contract on that exhale there. So I want you to think if about kind of closing your pelvic floor, almost like you are preventing gas or stopping urine. So that's going to give you, a contraction. I don't like the word, as you might know already. I don't really like the word Kegel because people tend to overdo them, not do them correctly. And I really like to do Kegels that are part of breathing exercises also because it's a little bit more functional and applicable to life. So you won't see me in our exercises recommending Kegels, but you'll see me recommending a lot of breathing practice to get that pelvic floor working again. But in our breathing practice, there is some contraction and relaxation going on. So we're really kind of trying to work through this range. Well, I don't want to go out the basement window, but we want to work through this range appropriately. And that's where we're going to learn to build some strength if you need it. Another kind of like gross and creepy way to see if you can do this and do this right is to actually, if you have a tampon in, is to observe how the string moves up and down. If you're adventurous, or if you're on a period right now, then it is something interesting to see because you can actually get a really good visualization of movement going on. Otherwise, you really just have to go 100% by feel, and some people aren't there yet. Now, what we do see sometimes and in some situations, and if you think that's you, definitely reach out to me. Sometimes one side of the pelvic floor can be shut down, and usually that's kind of an issue if you have like a one-sided issue on the body, which is maybe hip related. So fixing your hip is, it would fix your pelvic floor in that situation. So there are special populations. So let me know if we need to kind of work on that a little bit. Might require extra hip opening, hip work. Most women do have, two, three, four, five, or six things going wrong with them that kind of cause the pelvic floor. Sometimes it's not just an isolated issue of strength and weakness. So if you do have that, then we can certainly work on that. Now, if you just have weakness, practicing some really good contractions on your breathing is really a good thing. And but again, you can always take that to the extreme too. And we talked about that a lot in our challenge, our pregnancy challenge, which you can find in the desktop. So if you do want to review that, if you go under the challenge section in the desktop, you can rewatch the video from day 2 on the pelvic floor if you need kind of a briefing on that. All right, now let me know if you have any questions on this concept. Hopefully that helped. And all right, so let's go a little bit deeper and talk about, are you tight or are you weak? What is going on with your downstairs? So the women that, the symptoms for a woman that is generally has a tight pelvic floor usually find that sex is painful, tampons are uncomfortable to put in, or you really got to do a lot of work to relax before you put in a tampon, or you need a lot of lubricant with sex. If you have difficulty initiating urination or bowel movements, if you have painful constipation, if you have pain in the tailbone or low back, that could be a sign of a tight pelvic floor. And then also you can be tight, and we did talk about this earlier, is because you can't move through the full range of motion in that elevator. So you start on level 2 or level 3, and there's really it's a very limited range of motion that can occur. So you just don't know how to relax. So usually some people know this pretty easily right off the bat. You could certainly, and I do recommend this for a lot of women after they've had a baby, is to visit a pelvic floor physical therapist, and they will do a lot of internal testing. And obviously, we don't do any of that here. So if you are confused still, after this discussion, and you are somewhat concerned, then definitely I would seek out a pelvic floor physical therapist. And then if you are a weak pelvic floor, usually this is due to intensive, labor. Maybe you had, twins or some heavy babies. If you've just naturally all your life had poor breathing patterns, if you were that shallow breather, um, and working out too, if you worked out with heavy lifting and high intensity, and you're the type of person that instead of contracting the pelvic floor when you lifted, instead you bear down, you could be in that weak pelvic floor category if you can't initiate a pelvic floor contraction. So super interesting. I'd love to hear what you've kind of self-diagnosed yourself with, because we'll definitely want to handle these situations a little bit better going forward through with your exercises. So what to focus on if you have a tight or weak pelvic floor. So if you have a tight pelvic floor, I really want you to focus on the inhale and fully relaxing the pelvic floor and really try and get that pelvic floor back down to the ground level. Of course, you probably don't know which level, where your pelvic floor is hanging out, but really focusing on the inhale and the relaxation is going to get you pretty far. Retraining breath is super important with these individuals and relaxing the rest of the body too. So, are you a jaw clencher? Do you clench your abs? Do you clench your shoulders? Or are you just kind of like, super stiff and tight and like, I'm sure if you're that type of person, that you're just super rigid, and that might be you. And a lot of times, things like meditation and stress management come into play here. Now, a weak individual would benefit from focusing on the exhale, on that contraction portion of the movement. So, going forward, when you do perform exercises, depending on whether you're tight or you're weak, is how you're going to, initiate. So if you are weak, then you may not have to take this huge inhale, but you do want to focus on the exhale and kind of vice versa. So keep that in mind. And so another important thing is to start becoming more body aware here, especially if you are looking to get into jumping and bouncing and running. You really have to have a good mind body connection with your pelvic floor. Now, are you the type of person that leaks, or do you have prolapse, or do you maybe think you're susceptible to prolapse? And it is really important to note that usually the women that are leakers tend to be my tighter women for the most part because of what is happening with that over contraction and what's happening with the squeezing of the bladder. So my tight women, you're probably going to fall more on the risk for leaking. And then my weak women here, you're going to have a higher susceptibility to prolapse in the future. So if you think you're on the weak side, then you definitely want to hold out on things like running and jump rope too early without doing a lot of work with contracting and learning how to work your pelvic floor and build your pelvic floor. Leaking, of course, if you are leakers and you jump back into running, you're going to notice, piddling and things like that. Other than embarrassment, um, there's no real danger per se by maybe taking up some earlier running or jumping than my weak ladies. But you really want to learn how to relax and relax these muscles. So that's going to start helping with your leaking. So curious to see if we've got tight women, weak women, if we've got leakers, or if we've got maybe women that have prolapse issues. So definitely let me know if you're in one of those camps, and then that way I can make sure that you're well taken care of. If you're you think you're in the middle and unsure, you can't go wrong with learning to contract a little bit and then learning to relax a little bit. So if you think you're kind of somewhere in the middle, you need just a little bit of work, then, I would kind of focus on both your inhale and exhale, and maybe start with one first if it's too confusing. So this is my favorite part of our chat today, and it's why a strong pelvic floor goes hand in hand with strong abs. And I want you to, if you are momming right now and working on something right now, I just want you for the next 5 or 10 minutes or so is to listen a little bit more closely. So this is your meh, 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 warning, important info alert. So, because this is very surprising for a lot of women. So, the pelvic floor does not work alone. Surprise, surprise. So, thinking back to your elevator as a visual, just kind of keep that in the back of your mind. In real life, if you're trying to do a pelvic floor max contraction, so if we're working our way up that elevator, the pelvic floor does not work alone. It actually needs the help of the abs to carry out that contraction, and specifically our lower and deep abdominals. We're going to go into that a little further. Now, first, the pelvic floor initiates the contraction. So if you imagine yourself doing our breathing technique, our corrective breathing, maybe you're in your 90-90 position, you do your full inhale, your pelvic floor drops, and then on the exhale, you start to, initiate the contraction from your pelvic floor. And then, how we talked about kind of zipping up on the way up. Well, this first 30% of your contraction is done by those pelvic floor muscles. But then the last 70% of the movement is carried out with the assistance of the deep ab muscles, and specifically, and I want you to remember the names of these muscles. And I'm gonna show you pictures. And we're gonna talk a little bit more. Is the internal obliques and your transverse abdominis. So you may hear me talk about the IOs and the TAs. These are super important to your rehab, okay? So these deep ab muscles, the internal obliques and the transverse abdominals. So these are what assists your pelvic floor. So if you have a really weak pelvic floor, then chances are these muscles are also very weak too. Okay, so keep that in mind. If you have a very tight pelvic floor, chances are there's some extra ab gripping going on too. So we're going to talk about that also. So if you don't have strong abdominals in general, you can't expect to have good pelvic floor contraction. So, and a lot of times with these tight women, because they have weak abs, that pelvic floor is on overtime. Like it's working more than its 30%. So, we really want to kind of focus on changing the dynamic here. So, test yourself when contracting your pelvic floor. Make sure that you can initiate that exhale with your pelvic floor, and it doesn't come from your abs first, and it doesn't come from your glutes first. It's not like, a butt squeeze up, and it's not an abdominal squeeze either. It starts at the pelvic floor and then it goes up the elevator. So what does this mean for you? So there it is. Okay, so here's a picture of the abs, and I'm going to show, so this is the full picture, and then I'm going to break it down a little bit. So here are your six-pack abs, the rectus abdominis. Now, when a muscle contracts, it shortens. So what happens is it originates here and it inserts here. So and I wish I had a second pointer. So what happens when these muscles contract is this distance gets shorter. They come together. So what happens if these come together? You actually get more, and you actively do crunches. You do crunches, 100 crunches a day because you're doing a crunch challenge or something. This actually gets more bulky. And for a lot of women, we typically don't want this area more bulky. Now, our external obliques, which kind of start at the back of the ribs, and then they, attach here into this sheath right here. And we're going to think about shortening. These are going to shorten together. And what's going to happen is it creates a pushing down effect. So this actually gives you a little additional, if you have super tight and super strong external obliques, a lot of women will have a lower ab pooching happening. Now our transverse on this side over here, our transverse, if you can see, it's a couple layers deep. And then we also have our internal obliques here. These muscles work to kind of counter the activity of these two guys. So they kind of oppose each other, for lack of a better word. And these actually cinch the waist, where these guys can actually make the waist look larger and wider, depending on how we work them out and depending on the balance between these two guys. So when it comes to our exercises, and especially mom post-baby exercises, we're going to go into a little bit more why, is these are the guys you want to focus on, that transverse abdominis and the internal obliques. This is what we want to focus on to get rid of the mom tummy. So just to let you guys know. So you're not going to be doing crunches for days with me. And you're not going to be doing like those little side bicycles where you get your elbow to your knee. And that works a lot of the external obliques. No, because that pushes on this guy here. We want this to be flat. We don't want this, to be sticking out. We don't want to pronounce this. So, and we do want, of course, balance between these guys too for functionality. But for a visual standpoint, to get rid of the mom tum, keep these two muscles in mind. So moving on, I'm just kind of giving you a greater visual. This is how the transverse abdominis works. So you can, as you can see, if this were to tighten up, it's going to flatten out the abs. It's your corset. We want to strengthen this corset muscle. This here is our internal obliques. And as you can see, if this and this were to tighten and come together, you're going to get more of a flattening effect. So we want to work on that also. And then this is the rectus abdominis, and these are our external obliques. So when you are strengthening and contracting these, if you kind of look at the mechanics, again, they're going to cause some unwanted bulk, and they're not going to flatten out your belly like, we all hope for. All right, so let's get a little bit deeper, why the abs are so important. And so if you want the reference, let me know. But I did find an interesting study about the abdominal muscles of moms versus non-moms. So the observed muscle thickness in the internal obliques and the transverse abdominis, those two deep guys that I was referring to, during a breath hold, there was less muscle thickness in moms versus non-moms because of course, because in moms, these muscles get stretched out. So there is stronger and better muscle tone in the non-mothers versus the mothers. Pretty straightforward. Hopefully you're still with me. Now, secondly, it was observed that muscle thickness in the external obliques was actually the same in both of the populations, so both moms versus non-moms. So therefore, the size of the growing baby didn't have an effect on those external obliques, but just those deep ab layers, so that transverse abdominis and internal obliques. So the conclusion of the study was, of course, that the deep layers in moms were much weaker than the non-moms. So, and this was taken with, both C-section moms and, vaginal delivery moms. It was really that kind of the size change and the growth in the abs that really had the effect here, not the type of delivery. So, what does this all mean? So, anatomically, because the external obliques sit on top of those deep layers, and the fact that their function is to pull the ribs down, when you actually over contract and train the external obliques, kind of like in a crunch or the elbow to knee bicycles, it actually creates bulk and a lower belly pooch effect. So you want to, this is why I scream for days that, to avoid crunches and to avoid, certain ab exercises. Now, anatomically, the transverse abdominis and the internal obliques, they help to prevent that from happening because when they are strengthened, they create a flattening effect and in turn balance out that pooch. One, because they're able to counterbalance that oblique action, and just because naturally, when they become stronger, this creates a flattening effect. So you can kind of see where I'm going with this. So, because moms typically lack balance of these deeper abdominals and the increased relative strength of that external oblique and the rectus abdominis in some cases, the mom tum was kind of born out of that, is more of that weakness of those deep abs and the lack of balance going on. So no amount of crunches will fix that. And of course, I hope you understand now that crunches themselves are just going to make this situation worse. And what does this mean for you? And hopefully this is kind of the takeaway for all of you is women who leak tend to overuse their pelvic floor and external obliques because of lack of balance going on. Prolapse is typically caused by a lack of balance also, and a lack of support because these um, deep ab muscles don't have enough strength to resist if you come into a situation where you need to bear down, because they're helping with 70% of the movement. So I want to note here that if your lower abs bulge during exercise, so observe your abs when you exercise, then chances are that you are kind of the type of person that tends to bear down, and your pelvic floor is probably in that weak category, and it's not particularly safe in our moms because that can lead to prolapse. But if your lower abs tend to flatten during your contraction and exercise, then you're most likely keeping your pelvic floor safe because you're contracting when you're supposed to and you're relaxing when you're supposed to. And you're utilizing your muscles correctly so that they're working with you, not against you. So, what do we really need to fix the pelvic floor aside from doing Kegels all day long? The answer is undoubtedly we need to create balance by strengthening those deep ab muscles. So, again, the internal obliques and the transverse abdominis. So, hopefully, I have sold you on that. Now, what exercises in particularly strengthen these deeper abdominals and pelvic floor? Um, you're looking at one, first learning how to use them and when to use them, because a lot of times, um, if you're cued properly, then you'll just naturally do the right thing. But typically, without any prior information, a lot of us are doing these things backwards because they just might feel easier initially. Um, because sometimes, of course, correct breathing habits are a little bit different because of how our body has changed between pregnancy, and a lot of times most of us haven't learned to breathe properly anyways. Now, another fun way for you to really work on this is the 90-90 breathing method. Because it takes, when you are in the position of the 90-90 breathing, because the goal of the position is to shut off muscles that should be relaxed during breathing, they're a really good trainer. If you were to just do your breathing standing up, you'd get a lot of additional unneeded accessory muscles working. So the 90-90 breathing helps to turn on the right muscles and helps to turn off the right muscles so that you can get that mind body connection so that you can, of course, carry out your breathing correctly. And it's kind of like a mental training wheels, I guess, for lack of a better word. So you can um, kind of learn the correct patterns. Now, once you have mastered the 90-90 breathing, and then using that breathing pattern on various exercises and activities, once you know whether you're strong or you're weak, and knowing how to use your breath when you're strong versus weak, taking it to the next level and really starting to build those lower deep abdominals and the pelvic floor are really benefited when you start using balloon training. I know it sounds pretty crazy. So I want all of you to go onto Amazon right now, or when you go to the grocery store to do your shopping, make sure you write balloons on your list. I want you to make sure you have them definitely by the end of the week because they are going to be the staple of our workout. So you do have some time. Hopefully, it's early in the week you're listening to me. Hopefully, by Saturday's workout, you have balloons. So uh, definitely go grab some balloons, put that on your list ASAP. Exercises like dead bugs, leg lifts, leg slides, which you're laying on your back and your knees are bent and you're just really extending the leg and bringing it back to being bent. That's a leg slide. Hopefully that makes sense. Leg marches are another one, laying on your back with your knees bent and then just doing little slow raising and lowering in kind of like a march like uh, fashion. That is also going to strengthen those muscles too, especially once you incorporate that with your breathing. That's really going to take you to the next level. So stay tuned because at the end of the video, I'm going to go over how to find your transverse abdominis. And then we're going to go over balloon breathing also. And these videos will also be in your workouts this week. So how to support your pelvic floor during exercise and daily activities. You should know this by now. It should be second nature. It is, of course, breathing, your posture, your positioning when you're doing a lift, doing a squat, doing a lunge. The posture and positioning is going to have great effect on supporting your pelvic floor. How you breathe as you're going through your positioning is huge. Pressure management. We're going to go through this a lot more, but basically the coordination of the breathing through your movement is important. You want to, if you remember one thing, when it comes to pressure, it is exhale on the hard part. Exhale on the hard part. If you remember one thing when you're in the gym and you're starting to do heavier deadlifts or squats, exhale on that hard part. And you, for the most part, with a few little factors in there, you should be able to keep your pelvic floor pretty safe. Awareness. Of course, you need to be aware of what's happening. So tuning into your pelvic floor during your exercises are super important, especially when you start doing more intensity workouts. So if you're the type of person that wants to get into jumping or running, awareness needs to be your friend, and you should not be ignoring the signs and the cues and the communication between you and your pelvic floor. Of course, building the right kind of strength and learning how to contract and relax the pelvic floor. Of course, that's super important. So, learning if if you're the type of person that needs to really do a lot of contraction exercises to get that pelvic floor stronger, or maybe you're the type of person that needs to learn how to relax that pelvic floor so that you're not leaking all over the place when eventually you're jumping. So, how much time will this take to fix and improve? And of course, this is a moving target for a lot of women. And of course, this can change and fluctuate. And I want to say that it's like any sort of injury. If you think of it as an injury, I think that's kind of how most people have the best outcomes is if you treat it like you have had serious knee surgery, knee rebuilding. How long is it going to take? They say that it can take up to 12 weeks, but we have seen circumstances where it takes up to a year to, um, fully improve. So it depends on the nature, depends on what you're dealing with, depends on what's happening in your everyday life, depends on if you're working at this, if you're keeping up with your exercises. And I want to say that just because we are focused on the pelvic floor for 1 week doesn't mean that 1 week of exercises is going to fix your pelvic floor. All of these exercises are building upon each other, but it doesn't mean that we stop them once the week stops. So I want you to remember that. Um, and throughout this, we are going to be, still doing some pelvic floor exercises all the way until week 7 and week 8. But I want you to, if you know you have a specific problem, so if you know that um, you have a weak pelvic floor, you should be making a note of what your weaknesses are. And you need to keep up with those weaknesses well all the way through our program and maybe even beyond in some circumstances. So obviously, if you're the type of person that has bad neck posture, you obviously know by now that your neck posture is not fixed by this week. If you know you have neck posture problem, but your low back is good, then I wouldn't focus on those exercises. I would focus on your neck exercises. And the same goes with the pelvic floor and your core and other parts of the body. So we're really here to observe what our weaknesses are and then using these exercises provided um, to continue to strengthen them as we go on. So I I really want to stress the importance of that is um, if you find an exercise that is challenging, hard for you to do, is uncomfortable, you can't get it, those are the exercises that you need to document and you need to keep doing regularly until you get them right and until your body feels strong with them. And then you want to progress your fitness. And that ultimately means, can you add a stronger resistant band? Can you add extra weight? Can you do more reps? Can you do more sets? And that's how we're going to progress ourselves. So, what does this mean in real life? And how do we ensure that we're progressing in this area? And when it comes to the real life stuff, I want you to own it with these small things. Now, just like I said before, once you find out what your weaknesses are, what the areas you need to work on are, is I want you to nail down the foundation for those and keep doing these exercises. And you can do them for up to 12 weeks. You may need to do them longer. You may need to progress. And you always have to progress when you are working on strengthening and rebuilding and trying to get back to, um, more intense activities, being able to keep up with your kids. Building that solid foundation is one thing, but you need to progress it. So when this week or our time is over, slowly and progressively, these exercises that were given to you need to be done more intensely as you go on, and it's small increments. So that could just be reps. So next week I'm going to do 20 reps instead of 10. I'm going to add on a couple sets. I'm going to add on some extra weights or some resistance. And then maybe I'm going to see how I can incorporate these into other activities and movements. And, if you want to start doing classes and if you want to start doing other, gym type things, you want to see how your foundational movements can be applied to what you're doing. We're going to talk about that a little bit further too. So, in order to become stronger and bulletproof the body, you need to overload the muscles and the pelvic floor progressively. So, it is, you don't just jump from level 1 to level 12, for example, which level 12 is, let's just say, running, is you take it one step at a time. So, just remember that it's just a little bit at a time. Now, I also don't want you to be afraid to test yourself and try new things. So as you progress, try taking it up a notch so that you're not plateauing, so that you're constantly building strength, but always checking in with your body and being aware. And I want to note to be careful on plyometric activities, and that kind of fills into running, jumping, skipping, jump squats, any sort of explosive exercises. I heard this saying, and it's pretty cool. It's from my coach. She says, "Don't run to get into shape. You must get strong first in order to run." So it's kind of like chicken and the egg. So think about your posture, your pressure management, and your form when exercising at all times. So, how can you take it up a notch? And this is what we're getting into next. I'm going to go over first how to find your transverse abdominis. So, we're going to watch that video first. And then, secondly, our video is going to be breathing with a balloon. So, observe these here so that when you're ready to do these in your workouts, it's not, you're not learning from scratch here. So definitely take a chance, take some time and watch these videos. So we are going to learn how to feel and turn on our transverse abdominis muscle. So we're going to be thinking about, of course, our deep lower abs here. And first I want you to start by laying on your back, and you definitely want to lift up your shirt so you can kind of observe your belly and see what exactly is going on. So first things first, take your fingers and I want you to find your hip bones, the ones that stick out right in the front of the hip there. Those are called the ASIS, anterior superior iliac spine, but that's kind of an FYI. Now, I want you to allow your fingers to drop just inside of that hip bone there. And now that you've got your fingers in your reference point for this particular exercise, I want you to now allow your body to completely relax. So relax the abs, relax the pelvic floor, relax your glutes, your hip flexors. You should be fully relaxed in this position. Now that you're super relaxed, I want you to think about lifting your pelvic floor. So I want you to
do a squeeze and a lift. Now, as you lift, you should start to feel a tiny bit of contraction and firmness under your finger. And remember that the first 30% of contraction with the pelvic floor muscle um, just comes from the pelvic floor working alone. And the other 70% is when those deep abdominal muscles kind of help and assist and continue the rest of that contraction. So if you can only feel a small contraction, or maybe you can't feel any contraction under your fingers, maybe your pelvic floor is weak and you are unable to get past that 30% contraction there. So if you're in that category, unfortunately, you will not feel this. So you do have to work up on building your pelvic floor strength. So let's do this together. I want you to inhale, allow that belly to expand, your ribs to expand, and of course your pelvic floor to expand. And then on, of course, the exhale, I want you to lift the pelvic floor up, and you're going to be zipping up your abs with this because I want you to really feel those deep abdominal muscles contract. Now, remember those deep muscles that we spoke about, the transverse abdominis works to flatten the stomach. So you should see a, flattening effect occur as you are contracting. Now, make sure that this contraction is actually coming from the pelvic floor and not because you're tilting your pelvis or because you're squeezing your glutes. That is actually a cheat. So play around with the contraction and intensity and see what happens. Now, next, I just want to prove a point here and show you a comparison of what happens when we use our upper ab strength and it kind of overpowers the lower abs, and what it does for the low body, like that mom pooch there. So while still laying down, I want you to squeeze those upper abs. You may even need to do a little baby crunch just to overemphasize. But see what happens to that low belly. Do you see that it starts to pooch and stick out? Now, when we do that, we push on our pelvic floor, and that's a form of bearing down. And that is what happens when we leak, and what happens when prolapse occurs, or this can also worsen a diastasis. So you're putting too much pressure on that pelvic floor and causing that bulge in the abdominals. So that is why crunches are not the safest exercise or the best way to, deal with or fix that mom pooch that everyone talks about. So play around with this, and we definitely want to build strength in this area so that we can avoid that pressure downwards. Balloon breathing is a really effective way to work those lower abdominal muscles, the transverse abdominis, and really build up the strength in your pelvic floor. Now, it is important here that we remember not to bear down, and you want to keep your abs flat here as you are filling up the balloon. That is a sign that you are not bearing down on your pelvic floor. So let's observe here first a really good inhale and then exhale. And here is the full inhale. You can see there's a full back body expansion. And there is the exhale. As you can see that the balloon is filling up as she exhales. Her abs are flat here and she is filling that balloon.
Alrighty, so I hope that this presentation was helpful for you, and I hope you had a chance to watch and observe the two exercises at the end and maybe have even tried a little bit. And please let me know at any time if you have any questions. This stuff is really important, and this is where a lot of people tend to fall off this whole process. So if you've got everything up until now, then you have about 80% of what you need for success at getting back into sports. So keep up with it. Just because we're just doing one thing a week, again, doesn't mean that it's over. This is something that we're working on and progressing upon. And you may need to progress upon for weeks to come, even after the program is done, depending on level of severity. So I'm just giving you the tools. This is the tools and building blocks to get you going. Thank you for watching. Again, let me know if you have any questions. I'd love to hear if you have a tight or weak pelvic floor. I like to hear if you're leaking or if you have prolapse or if you have any extra special considerations during this time for me that we need to troubleshoot. And we'll also take care of that in coaching. Thank you.